A few years ago in the hospital, everything was on paper, or I should say, currently in some countries, everything's just always on paper. But today, algorithms and different areas in tech are affecting decisions and the way everything runs. So, how is tech being used in healthcare today? A couple of weeks ago, a friend asked me about this, and it was an opportunity to share things I know and love. So I'm going to be taking you through the four ways tech is currently being used in healthcare today. First, we're going to start with diagnosis. This is like AI reading X-rays, CT scans, MRIs, like detecting cancer, early disease detection. This is just when you come into the hospital, you have something checked, you have like your EHR data, electronic health readings. I would put the right thing up on screen. But like, yes, this is when the AI tool or algorithms helps detect if you have a disease or not. This is simple diagnosis. And it's done probably like all over the world. It's probably the most exciting part of health tech, at least for me. I think that way. So the next thing we'll be talking about is clinical decision support. This is also important because this means algorithms are able to suggest treatment, predict how you react to a particular drug. If some, like for example, if you have like an allergy or something, the algorithm can be like, okay, instead of this, we can try this instead. Like it can also predict treatment based on how close you are to other patients. For example, if we have like 1,000 patients in our hospital, a really small hospital, really, and we find out like based on the data we've collected, you are similar to this patient. So we know, okay, maybe this treatment plan that worked for this patient might work for you. This is some kind of like unsupervised learning. And it's a good way how like algorithms still support doctors. Like also I should mention like doctors still have to find out CNO. Yeah. And another important, or I should say more common way, is scribing. Scribing should actually be a separate section on its own, but I'm going to put it under clinical decision support because what it does is it helps the doctors take notes. For example, while having a conversation, I'm the doctor, you are the patient, and a medical scribe takes notes in a structured and standard way using like the SOAP what's it called? SOAP style, SOAP. And it takes its medical notes so the doctor can focus on you and empathize with you. Because when GPT-4 came out, I guess there was some research saying like LLMs are more empathetic than doctors. And we think about it this way, like, are they more empathetic because they are better or just because they have more time to focus on you? When you get to the hospital, you see a doctor, the doctor has to like take notes, they have to like listen to you. There's so much they have to do. And these little administrative tasks actually reduce the quality of health care service they provide to you, the patient. So medical scribes actually just take these standardized notes and the doctor can later take a look at them, check the mistakes. They can probably like get some automated charts made from the stuff already. They can also like use RAG all over it when they have your healthcare data, they have these notes, they have so many things. And also, person can miss something. For example, I come to the doctor and I say, oh, I have an earache. Actually, it goes down to my neck. You know, these medical scribes are good at understanding this context and nuance and breaking it down. They can also suggest plans based on the notes they take. But remember, the doctor has the final say. Third on our list is hospital operations. This is like there's like, predicting patient wait times, scheduling the doctors, like ICU beds. Just this helps with the smooth running of the hospital. These are like behind the scenes stuff. You don't need to think about them as a patient, I think. And lastly, the most common patient facing tech. What is this? Like we have wearables, your Apple Watch, your Fitbit, all of that. They keep track of like your steps and all of that. These are just like I would say lightweight. They also use like important algorithms. For example, if you use the Apple Watch, like if you just like are in the Apple ecosystem, you can use your phone or any other device to measure your gait, how long how long your feet are on the floor. For example, if you walk majorly with one foot or the other. So this is a part of like patient facing tech. We also have these apps that help you monitor other aspects. For example, we have I think it's Noveritech, which helps you track like your skin diseases and all. You can take a picture, measure your acne, like, okay, today it's this big, tomorrow it's like this big. I think it also like optimizes the products you use, all of that. So these are patient facing tech. We also have like symptom checkers. And another important patient facing tech I like is, for example, here in Turkey, we have this e-nabis thing. It's just a way where you can keep track of your hospital visits, like the drugs you're given. You can also look back at like your past scans. For example, when I go to the hospital and I get like a scan done, I love to go back and be like, okay, what is actually on the scan? For example, I also use my scan for the personal projects I work on, which it's not a problem because it's my data, so I don't think it's a huge problem. But just the different ways AI is used in healthcare, I look forward to seeing how advanced it could be. Currently, people are talking of like drug discovery, like cancer, all of that. It's amazing. It's exciting. But I wanted to talk about like four realistic ways AI and tech in general is being used in healthcare. Thank you.